Hi guys, this is Lohita. I want to explain about positive and negative effects of coronavirus. Positive effects of coronavirus are helps you build genuine relationships. The COVID-19 situation has positively impacted the way you emote and maintain relationships. We get to spend our time with our family and plan our work better. This actually helps to build a better future for both our work and family. Entire lifestyle changes to practice better hygiene. Corona changed the people aware of how important it is to keep ourselves clean, from shaking hands to namaste. We all have had a lifestyle change for the good. We are going to remember to cover our mouths when you cough, to sanitize our hands after touching anything else, because we know what can happen if you don't. Educational become digitized and affordable. Educational institutions have found a way to overcome this immensely challenging series of events. Online classes have become the new form for educational institutions. Institutions can now save on the infrastructural cost, and as a result, the students need not to bear the brunt of the cost. Moreover, parents will get first hand knowledge about how classes are tough and can directly understand how their child perceives concept. The air is cleaner and the environment is greener. Greenhouse gas emission and pollution level across the country have fallen significantly. Reduction in the environment pollution, mainly air, sound, and water pollution, will be reduced. Reduction in crimes such as drug addiction, alcoholism, violence, and suicide. More utilization of the internet for sharing ideas, new knowledge, etc. There will be more research on COVID-19, particularly discovering a vaccine and medical strategies which are more effective in patient management. The negative effects of coronavirus are the pandemic situation has spread as a global pandemic disease, which is creating fear, stress, stigma, minimizing social networks, etc. Health and medical systems, especially biomedical system, have taken their maximum effect, but the healthcare system itself is affected due to various conditions in nature. There are many deaths reported through the biomedical system has made an enormous effect. High rate of deaths due to various illness or complication of diseases occurring amongst the patients, especially the elder who are affected by COVID-19. Impossible tasks and challenges to the medical staff, supporting staff, social workers, and health administrators at local, domestic, or all global levels. The World Health Organization is the entity followed by other United Nations agencies, which are responsible during a regional and global pandemic situation. Some countries such as Italy, Spain, USA, and China and a few other European countries are facing a much higher disintegration in all subsystems of society. Downward trends of family, economic condition, and several lower social classes facing unbearable economic hardships due to lack of daily or monthly earnings. Disruptions of schools, university, and vocational educational segments where they have to seek certain optional strategies to cover up their educational goals. There are many people who are losing their jobs and incomes in formal and informal sectors in society. Global and economic recession and increase in poverty level in society. Thank you.
Hi guys, this is Anusha Morukutti. I want to explain about opinion of government on COVID-19. India has zero point 0.9 hospital beds and zero point 0.7 doctors for every 1,000 peoples against the WHO mandatory. The opinion of our government is that the COVID-19 was to be very severe in conditions, and we have to be very careful, and also we have to take vaccine of COVID-19, and also our economic importance also affected by COVID-19. So many people have died due to corona. With the increasing number of coronavirus, the government has locked down transport services, closed all public and private offices, factories, and restricted mobilization. Based on recent studies, some economists have said that there is a job loss of million peoples. For India, given its healthcare, lockdown is as a prevention measure as with a community spread of COVID-19. India does not have enough doctors and hospital beds to provide treatment. The lockdown is a way to implement state enforced social distancing. The keyword in in the ongoing corona episode is social distance. The virus spread through person to person contact, and the only way to limit its spread is to identify the people who got affected. With the proper screening and lockdown of the affected person, the viruses can be eradicated within 14 days. The reason why South Korea is successful is because testing and isolation of the affected and are done at a rapid speed. Latest figures from our World in Data suggest on April 23, 2020, South Korea tested 11.34 people for every 1000 people in comparison to totally, and Italy testing 26.72 and UK testing 8.67 and the US testing 14.06 people for every 1000 people. In India, we do not have an adequate number of testing kits. As on April 23, 2020, India has tested only 0.362 for every 1000 people, in spite of having a much higher population than the UK, South Korea, and the USA. In fact, the state of Kerala, which has successfully dealt with controlling the number of corona related deaths and has pointed out the importance of aggressive testing, contact tracing, and a host of safety measuring, which include delivering food to the family of the affected persons. One can assume India is underreporting the actual number of affected persons, as is the case with West Bengal. The suggestions for home quarantine is a way to signal that there may be more number of affected persons in the state than what the officials suggested. The question everyone is asking is how will the statistics change if India is to do a proper number of testings as is done in the case of the developed countries. Thank you.
Hi everyone, I am Mahima. I want to explain about COVID vaccination. COVID 19 is a major health challenge throughout the world. Experts and authorities are working to develop and administer vaccines and enact other preventive measures. COVID 19 vaccination is now offering a way to transition out of this phase of the pandemic. Fortunately, the beginning of 2021 So, numerous vaccines given emergency approval and begin their roll out in countries across the world. Currently, a total of 7 COVID 19 vaccines available across 3 platforms have been approved and are being rolled out across the globe. Vaccines makes the immune system behave as if the body already had this illness. It achieves this without making the person sick. After vaccination, the person develops immunity to the disease. Their body can fight off the infection if exposure to the pathogen. An effective vaccine stimulates the immune system without kicking into overdrive. Vaccines also need to be safe for everyone, including people with allergies, young children, people who are pregnant or breastfeeding, older adults, and people with underlying health conditions. Most COVID vaccines requires 2 doses to work. It takes time for your body to build protection. Adequate immune response takes 2-3 weeks after completion of the entire vaccine schedule. Types of COVID vaccine. Researchers have used various approaches to developing vaccines that protect against COVID 19. As a result, they have developed different types of vaccine, including first one, whole virus vaccine, also known as an inactivated or weakened virus vaccine. This type contains dead or inactivated form of the virus. These vaccines cannot cause an infection because they do not contain the live virus. Vaccines made by Sinovac, Bharat Biotech, and Wuhan Institute are examples. Second one is recombinant protein subunit vaccine. This type of vaccine triggers a strong immune response to a key part of the virus. It cannot cause an infection because it does not contain a live pathogen. Third one is replication incompetent vector vaccine. This type is used for carrying genes that the body can express to provide immunity. Fourth one is nucleic acid vaccine, so called as mRNA vaccine. It involves injecting genetic material, that is mRNA, into the live host cell. In a COVID 19 vaccine, the mRNA contains instructions for producing coronavirus spike protein. The vaccine presents this information to the immune system, and as a result, the body produces antibodies to beat the virus. Pfizer, BioNTech, Moderna have developed this type of vaccines. First indigenous vaccine is developed by Bharat Biotech in association with Indian Council of Medical Research and the National Institute of Virology, that is the Covaxin. Doses ordered exceeds 10 million and its 81% efficacy. Vaccination is based on priority list. Since everyone have to take this, so the initial supplies provided to the healthcare personnel and the elderly people. Next list include the frontline essential workers, people aged 65 to 75, like that vaccination will reach to more groups. The goal is for everyone to have access to a COVID 19 vaccine. Longevity of the immune response in vaccinated individuals is yet to be determined. So, it is absolutely necessary that everyone who has received the COVID 19 vaccination should continue to follow the COVID 19 appropriate behavior. That is, always wear a mask while in public, proper hand sanitization to protect ourselves and those around us. Stay safe, stay healthy. Thank you all.
Hello everyone, this is me, Pritika Shrija of Class 12A. I am here to say about some of the impact of COVID-19 on different sectors. As the coronavirus infection is spreading and risking the lives of people globally, it has also created a deep economic distress as some business struggle to stay afloat. Most online companies will see their revenue and profits getting impacted amid the COVID-19 pandemic. But the impact will be different across sectors as the country cases loud down in some parts, even with the sufficient stimulus package, if only partial uplifting of the lockdown until mid-May. It will put at least 32 million jobs at risk in India, as per the report by
McKinsey and Company. It says the costs of the stabilizing and protecting household companies and lenders could exceed $130 billion. In case of the second wave or more, lockdown impact will be even deeper in the terms of sectors. The aviation sector is the hardest hit, while pharma and IT companies are in the better position. But this aviation slump has the direct impact on Indian IT companies and could mean to 7% drop in revenue in the coming quarters as per experts. The hotel industry has also seen a major disruption after the aviation sector. Hotel industry revenue is likely to fall by the rupees 90,000 crore due to COVID-19 impact. Auto and advanced industries will be next in the line with no near-term relief to the sector. For the first time ever, India set to report zero automotive sales in India, and the sector is unlikely to have the respite anytime soon. Construction and real estate and textile industry are majorly hit if we compare to the some quarter of the previous year. As for the money controls, own luxury housing may see a 20% reduction in price, while developers are likely to offer free buys to buyers. Invest in the mid segment. Food and utility sector is estimated to not see a thaw in consumption by more than 10% if the current scenario plays out. So largely strained debt to service ratio is anticipated in the travel and transport industry, which includes a logistic along with the hotel and entertainment industries like movie theater. The falling of crude prices also hints the weakened demand in the energy segments. Global energy demand could slump by 6% in 2020 due to lockdown restriction, in what could be the largest contraction on record as for the International Energy Agency. As Indian consumers are expected to spend continuously this year, consumer and retail segment is also anticipated to be soft, or the less chemical and agricultural sectors can also see a drop in the quarterly output. But parameters, IT and telecommunication are a relatively strong sector as lockdown has shown up some unprecedented challenges to the pharma sector is better placed to navigate the coronavirus outbreak. As per brokerages, the report also estimates that almost 25% of MSME and smaller medium-sized enterprise SME loans can turn bad. The corporate sector might see a 6% default rate, with sectors like aviation, textiles, power and construction so showing a higher rate with around 3% default in the retail segment, with layoffs and pay cuts seen in the aviation and others. Following will be the cases of concern after the pandemic is over unemployment, liquidity risk and business risk. Thank you guys.